Assalamualaikum and salam sejahtera. I'm Dr. Siti Khadijah Adam. I will give you a brief introduction on antidepressants, and in this lecture, I will give you some tasks for you to complete before our actual class later. So basically, at the end of this topic later, you should be able to list the examples of antidepressants, describe the mechanism of action of the drugs, explain the adverse effects of the drugs, identify the clinical uses of the antidepressant drugs, and also you need to know what is mania, the mechanism of action, and the adverse effects of the drug that is used for mania. So in this introduction, I will mention a bit on depression, about monoamine theory, the objective of therapy for depression, what are the major classes of antidepressants, and a bit on drug interactions involving antidepressants and the clinical indications. And also finally, I will explain a bit on mania and its treatment. So what is depression? Actually, depression is the most common mental disorder in developed and developing countries. So I think that you know that currently there are many people that has depression, and for example like celebrities on Hollywood like Jim Carrey, the writer of Harry Potter, and also Amy Winehouse, who has passed away. These are the examples of celebrities that have admitted that they have depression. And actually, depression also is quite common in Malaysia, especially in undergraduate students. Research several years ago has found that more than 30% of Malaysian undergraduate students have moderate and severe depression. So basically, patients with depression, they can show some symptoms like retardation of thought and action, they have sexual dysfunction, and also they have sleep disturbances and loss of appetite. And also they have some negative emotional symptoms like they always feel misery, they have low self-esteem, they have loss of motivation, and so on. So the cause of depression has been researched many years ago, and scientists have concluded that the cause of depression is due to low of serotonin or low of noradrenaline, or can be both because of low serotonin and low noradrenaline. And this finding is called as the monoamine theory. So basically, you need to know about serotonin and noradrenaline first. And I believe that you have learned about the synthesis of these neurotransmitters, the metabolism, and also the action of these neurotransmitters in your previous lecture in the neurotransmitters in the brain class. Yeah. Okay. So basically, because depression is related to low of serotonin and low of noradrenaline, so the objective of our therapy is, of course, we want to inhibit the transporter that reuptake those neurotransmitters. So we want to inhibit the transporter, and also we want to inhibit the enzyme that metabolize the neurotransmitters, right? So these are the major classes of antidepressants. We have 5 major classes. The first one is SSRI, selective serotonin reuptake inhibitors. Second, we have SNRI, serotonin noradrenaline reuptake inhibitors. We have TCAs, tricyclic antidepressants. We have monoamine oxidase inhibitors, MAOI. And lastly, we have the atypical antidepressants. So basically, you need to know these 5 major classes of antidepressants. Basically, all antidepressants that are currently being used, they have rapid oral absorption. So usually they are given through oral. They are tightly bound to plasma proteins. they are metabolized in the liver, and also they are excreted in the urine. Okay, so the first class of antidepressant is SSRI, selective serotonin reuptake inhibitors, and the examples are like fluoxetine, sertraline, citalopram, and so on. So SSRI is usually used for moderate degree of depression, and currently SSRI is the most commonly prescribed antidepressant because it is safe. Patients can tolerate with SSRI as compared to the other antidepressants. It is cost effective, and it has also broad spectrum of uses, not just for depression, but it can also be used for many other conditions. So from the name itself, selective serotonin reuptake inhibitors, you may identify what is the mechanism of action of the drug. So your task is to find out the mechanism of action of these drugs and also what are the adverse effects of SSRI. Okay. Second is SNRI, serotonin noradrenaline reuptake inhibitors. And the examples are like desvenlafaxine, venlafaxine, and also duloxetine. Okay, so SNRI the action is similar to SSRI, but you need to find out what exactly the mechanism of action of SNRI and also the adverse effects of these drugs. Okay, but both SSRI and SNRI, their effect or their action is very specific as compared to the other antidepressant. The third class is tricyclic antidepressant or TCAs, and the examples are like amitriptyline, imipramine, and so on. And these drugs, TCAs, they are actually dominant antidepressants before SSRI were introduced. Okay, but currently they are still being used in patients who are unresponsive towards SSRI or SNRI. So basically, the first two classes of drug, they are the most commonly used currently, but TCAs are still being used. Yeah. But TCAs, they lost their popularity because they have poor tolerability. Some patients cannot tolerate with the drugs. The drugs have narrow therapeutic index, and in the case of overdose, it can cause death to your patient. And also, similar to the other antidepressant, they also have possible drug interactions. Okay, so TCAs, the mechanism of action are not as specific as SSRI and SNRI. They inhibit serotonin and noradrenaline reuptake, but they can also block some other receptors as well. For example, okay, amitriptyline, they can block serotonin transporter. They can also block noradrenaline transporter. Okay, but they can also block minimally on serotonin 2 receptor. They can block histamine H1 receptor, alpha 1 receptor, and also acetylcholine muscarinic receptor. So basically, the effects are not as specific as SSRI and also SNRI. Okay, so you can see for the other examples as well. If you refer to Katzum, so you can see a table that lists down all the antidepressants and what receptors that they act upon. Okay, so your task is to identify the mechanism of action of those TCAs, which receptor that they bind actually, and also based on those receptors that they bind, what are the adverse effects of the drug. For example, TCA's adverse effects can be so many. Some of the drug, they can cause anti-muscarinic effects. For example, like amitriptyline and doxepin. They can cause these effects like dry mouth, blurred vision because they can also block acetylcholine muscarinic receptor. Okay, some TCAs, they can block alpha adrenergic receptor. So this can cause postural hypotension. Some drugs can cause sedation because it blocks histamine H1 receptor, and so on. So basically, TCAs have a lot of side effects depending on which receptor that they act upon or they block. Now, the fourth class of drugs is monoamine oxidase inhibitors, and the examples are like phenelzine, selegiline, and moclobamide. And monoamine oxidase inhibitors, they are used in patients who are unresponsive to other antidepressants that I mentioned before, the other three classes. And one thing about monoamine oxidase inhibitors is they have extensive first pass effect. So this will reduce the bioavailability if the drugs taken orally. Monoamine oxidase inhibitors use is limited due to complicated dietary restrictions. Okay, patients taking monoamine oxidase inhibitors, they have to limit the intake of some kind or some types of food because it may interact with the drug. So your task is to find what kind of dietary restriction that should be taken by patient consuming monoamine oxidase inhibitors. Okay, one thing that you need to note is when you learn about anti-Parkinson, you may find selegiline. Okay, selegiline is monoamine oxidase inhibitors. The main use of selegiline is for Parkinson, but it can also be used in depression. And if it is given for depression, it is given as transdermal patch. Now, for monoamine oxidase inhibitors, okay, so you need to know first the enzyme itself, monoamine oxidase A and monoamine oxidase B, what neurotransmitters or what molecules that they metabolize, and what happens when we inhibit those enzymes. Okay, the examples just now, like phenelzine, like moclobamide, and selegiline, you need to know which enzyme that they inhibit, whether it is A or whether it is selective towards B, or whether they can inhibit both A and B, and whether the blocking is reversible or irreversible. Okay, so again, you need to know the explanation of the mechanism of action of this drug and what is the adverse effects, okay, of the drug. And the final class is atypical antidepressants, and we have examples like mirtazapine, bupropion, and so on. So atypical antidepressants, they are similar to TCAs. Their action can be so many. They are not as specific as SSRI, SNRI, or also monoamine oxidase inhibitors. Okay, for example, like mirtazapine here, they can antagonize alpha-2 receptor and also serotonin 2 receptor. And this drug can cause weight gain and sedation. Okay, for example, like bupropion, they can inhibit dopamine reuptake and also noradrenaline reuptake. And what happens when bupropion inhibit this neurotransmitter reuptake? Okay, so you need to find out. And also, bupropion can cause some side effects such as dry mouth, sweating, and so on. Okay, so please read more on atypical antidepressants. Right? Now, one thing that you need to note about antidepressant is the patient taking antidepressants, they have possibility of having drug interaction. For example, patient taking monoamine oxidase inhibitors, they cannot take any drugs that can increase serotonin level concurrently. For example, like SSRI, SNRI, and also TCAs. Why? Okay, what happens if a patient taking monoamine oxidase inhibitors together with this drug, and why does it occur? So you need to find out. And also monoamine oxidase inhibitors, they cannot take this drug together with tyramine, and also you need to find out why and also what will happen to the patient if they take this concurrently. And antidepressant, they are the substrate for the cytochrome P450 enzymes. For example, like duloxetine, it is metabolized by CYP1A2 enzyme. So what happens if we give duloxetine together with fluoxetine, for example, because fluoxetine will inhibit the enzyme? Or what happens if we give duloxetine together with omeprazole? Okay, omeprazole is the drug for peptic ulcer. Okay, so because omeprazole will induce the enzyme, so what happened? So basically, you need to know also the possibility of the drug interactions of antidepressants when they are taken together with other drugs concurrently. Now, just to mention some of the indications of antidepressant. For example, like patients with major depressive disorder, SSRI is always the first line of agent. For anxiety disorder, for example, okay, we can use antidepressant, SSRI, together with sedative drug like benzodiazepine. For eating disorder, for example, in bulimia nervosa, we can use fluoxetine, SSRI, or we can also, for obesity, we can use bupropion. And bupropion is also can be used for patients to stop smoking. So these are some of the clinical usage of the antidepressant. Now, I would like to explain a bit on mania. Okay, what is the difference between depression and mania? So mania is totally opposite of depression. Okay, in mania patient, they have elevated mood and energy level. They become so enthusiastic and they have high self-confidence. Okay, so that is basically totally opposite of depression. And depression may be due to low of serotonin or noradrenaline, but mania may be due to the hyperactivity of some neurotransmitters. Okay, in a patient with bipolar disorder, okay, so I know that you have heard about bipolar disorder. So patient with bipolar disorder, they have oscillating depression and mania over a period of time. So the mood keep changing. Sometimes they can be depressed, sometimes they become mania. And the typical drug that is usually used for bipolar disorder is lithium, together with other antipsychotic agents. You have a lecture on antipsychotic agents, so I will only explain a bit on the lithium. So what is lithium? It is actually a mood stabilizing drug, and we use lithium in bipolar patient because we want to control the mood swing characteristics, especially during the mania episodes. One thing that you need to remember that lithium has narrow therapeutic window, and it also has delayed onset of action. So basically it takes 2 to 3 weeks to produce an effect. The mechanism of action of lithium is actually unknown, but some researchers believe that lithium can act on the sodium or potassium pump. Okay, so you know sodium potassium pump in the generation of action potential. So you know that sodium will generate the action potential through depolarization. So they believe that lithium can mimic the role of sodium in generating action potential because it has similar characteristics. So lithium can mimic the action of sodium by entering the cell and cause depolarization. But lithium tends to accumulate inside the cell, and this will prevent the cellular re-entry of potassium. Remember, your potassium needs to re-enter the cell to cause repolarization. And because of the prevention of re-entry of potassium, so this will lead to a fall in membrane potential, cause changes in the conduction, and also generation of action potential, and eventually on the neuronal excitability. Okay, Another possible effect or another possible action of lithium is they have effect on the second messenger system. So you know that some receptors, they have second messenger. For example, like inositol triphosphate and also diacylglycerol, they are the second messengers for alpha adrenergic and also muscarinic receptors. So lithium tend to inhibits the formation of second messenger, especially on the IP3. So lithium will disrupt this pathway. The formation of your second messenger will be disrupted. So it can block many receptor mediated effects, and eventually it can stabilize the mood of the patient with mania. And again, you need to find out what are the possible side effects and adverse effects of lithium, right? So basically, now your task is, I have mentioned all the 5 classes of antidepressants. I also have explained on mania and also the drug that is used for bipolar disorder. So your task is to identify the mechanism of action and also the adverse effects of the drugs, the 5 major classes of antidepressants and also lithium. And also remember the drug interactions that involving antidepressants. So you need to really understand what happened when there is drug interactions involving those antidepressants. You may refer to these books. I mainly refer my class from Katzum's, but you also may refer from Rank and Dale or Lippincott's. And for the clinical usage, you can refer to MIMS Malaysia and also the CPGs by the Academy of Medicine of Malaysia. So I think that's all from me. I hope that you can complete these tasks properly before the class this Thursday. And we are going to further discuss about the drugs later during the SGT. So thank you. See you during the class. Bye.